Hi, folks. Today is Monday, June 22nd, and a few updates for you from late last week and over the weekend. Starting with Birch Hill, we had our state surveillance testing last Monday, and we tested 75 people, a combination of all health center residents who had not previously tested positive, and then all of our healthcare staff, folks who work in the healthcare center. Of the 75, we've gotten 73 results back yet. We're still waiting for 2 staff members. Those folks, of the 73 results, we've learned of 3 asymptomatic positives, 2 residents and 1 staff member. The good news is none of these folks have symptoms. They're not ill. And we hope that if that continues, we'd be able to resolve those cases next week. RiverWoods Exeter did its state surveillance testing in the health centers last Wednesday, Thursday, Friday. We tested 297 people in RiverWoods Exeter. Gotten about a third of the results back so far. At this point, all negative, which is great. We are awaiting about 2/3 of the results, and we'll keep you posted on that. And then Riverwoods Durham, we learned over the weekend that we had a resident who had living independently, and this individual went off-site to visit family early in June, spent a few days off-site, came back, followed all the appropriate self-quarantining procedures, went to Rite Aid to be tested, and on Saturday, when the result was received, it was positive. So that's a bummer, but additionally, asymptomatic. This is an individual who was as surprised by the result as we were. So the good news, I guess, if there can be good news, is that we have a good self-quarantining process. This is someone who followed that process properly, and the risk of transmission in the community is quite low because of that. What we are doing, however, because we aggressively test, and knowing is better than not knowing, we have established testing for all residents. That will happen on Tuesday at Riverwoods Durham. And we will also additionally test all of our staff who work at Riverwoods Durham, because knowing is better than not knowing. And so that will allow us to do a few things. It will allow us to be sure that we can open back up the community to communal activities, but also help to ensure that our process really does work. So just testing ourselves as we go through this. We are going to be in this a while. What's happening in New Hampshire is really positive. The trends in terms of active cases are going down. Manchester, which was our highest, at some point Manchester had almost more than 500 cases, is now under 200. It's 178 active cases as of the weekend. That's real progress. Exeter and Durham and Rockingham and Stratford counties have maintained a very low level, and we feel positive about that. So a lot of good things. But we also see, and I know you read the newspaper and watch the news also, the number of cases around the country. There are 23 states where case counts are climbing. So we're balancing that. What happens when states open up? What's the delay in from the time that states reopen to the time that case counts start to creep up? We're looking at that every day. We're looking at what's happening in our state and in our counties, and looking at it with a 7-day average, looking at it on every at peak of every day. So we'll continue to track that. We know this is a time when people are anxious to get out and restart normal life. I think what I would say to you is the risks associated with restarting normal life are out there, and we're going to have to deal with them. It doesn't mean we won't. But normal has a new definition. As you think about being outside of our communities, I will say the same thing we say to our staff team. Avoid being around, number one is avoid other people, for one. Avoid being around large groups of people or being around people you don't know. socially distance. That's some people are better at it than others. When you're out, you'll realize that. Wear a mask. Wear a mask as often as you possibly can. Have hand sanitizer with you as much as you can. And then limit time that you're in and among other people. So, everything we're reading right now speaks to you don't want to be in a face-to-face conversation with someone for an extended period of time, particularly someone that you don't know, or you don't know how they've been living. And in terms of mitigating risk within our communities, it really is all about socially distancing. I mean, stop me if you've heard this before, but maintaining 6-foot distance between you and a staff member or you and other residents, wearing a mask if you cannot do that, and even if you can, it's just an added layer of security. And then again, washing your hands as much as possible. So I think what I would end with is just to say that we're all in a bit of a rush to get back to normal, and the weekend's news really does, it sort of wakes us back up to say we have to maintain our vigilance, even as we open up more, as we go out into the world more. The virus is out there, and we will contract it, and we will do what we need to do when that happens. We're prepared for that as an organization and as a community. But there are things that each individual can do to mitigate that risk. We can't eliminate it right now. That's going to take a vaccine. But to mitigate the risk, avoiding large groups of people, avoiding people you don't know, washing your hands, maintaining distance, and wearing a mask. Those are all the kind of things that we can, as individuals, we can take as our personal responsibility. So with that, I will say to you, I'm very pleased by New Hampshire's numbers. I'm a lot less pleased by some numbers that are happening in other states that reopened earlier than us, Texas and Florida and Arizona, and some states where folks really have pushed back against the concept of wearing a mask. I don't think wearing a mask is all that awful. It hides some of the things that I'm not really fond of with the moneymaker here. And that's a simple thing we can do. So with that, I'll leave you for today, and we'll give you more updates as we get more results in. Thank you.